Americans are one of the unluckiest people in the world when it comes to their health care. And even though they pay some of the highest prices in the world for medical services, they also have one of the worst life expectancies among developed countries. So what's going on? Well, in today's video, we will expose the ugly truth about the American healthcare system and why millions of people secretly hate it. So make sure to watch until the end because it might just save your life one day. Just make sure to stay updated with all that good stuff. And here is a little disclaimer that you can skip if you don't care about getting sued. Alright, now let's get into it. First, we need to talk about how much money Americans spend on healthcare because it is literally outrageous. Even though the US spends more money per capita on healthcare than any other country, Americans have one of the worst life expectancies at birth of all developed nations. At 78.6 years, Americans fall behind many countries which spend far less money on healthcare. In fact, the United States spends nearly 3 times as much per person as the next highest developed country, Norway, which spends around $6,425 per capita. Yet Norway has a life expectancy of 83.9 years, compared to the United States at 78.6 years. Americans spend over $12,942 per person every year on healthcare. But where does all that money go? Well, the answer is actually quite shocking, and a lot of it goes to administrative costs. The U.S. healthcare system has high administrative costs due to its complex structure of public and private insurers, providers, and facilities. These costs are estimated to be around 30% of total healthcare spending in the U.S., which is much higher than other countries with single-payer systems. And here's another thing: Americans pay out-of-pocket medical expenses. Americans are responsible for a significant portion of healthcare costs, even with insurance. High-deductible health plans are popular, which require policyholders to pay a certain amount out of pocket before insurance kicks in. According to the Kaiser Family Foundation, the average annual deductible for employer-sponsored health insurance was around $203 in 2023, and deductibles are rising faster than overall healthcare costs. This means that Americans have to save up money in case something happens and they need urgent care. Also, you should know that copays and coinsurance are very common in the United States. Most health insurance plans require patients to pay a fixed amount or percentage of the cost of medical services in addition to premiums and deductibles. So, when you go to the hospital, you have to pay your copay first, and then your insurance company pays the rest of the bill. But sometimes you have to pay the entire bill by yourself. So, even if you have health insurance, you may still have to pay out-of-pocket expenses, which makes Americans hate their own healthcare system. Another reason why Americans hate their healthcare system is the insane drug prices. The United States has the most expensive prescription drugs in the world. And here's the problem. Many essential medications are unaffordable for many Americans, leading to treatment delays or skipped doses. A survey by the American Journal of Medicine found that around 40% of Americans had problems paying for their prescriptions and 14% couldn't afford them at all. Here's an interesting example. The U.S. spends $2.3 trillion annually on prescription drugs, more than any other country. However, Switzerland, which spends half as much per person as the U.S., has similar health outcomes. Americans spend almost 4 times more on drugs than the average OECD nation. But here's the kicker: Americans don't get better health outcomes for these high drug prices. The U.S. ranks 38 in terms of health and well-being among 111 countries. There's no excuse for these high prices. The U.S. government pays billions to drug companies through Medicare and Medicaid, driving up prices even further. If you want to see for yourself, check out this list from the New York Times. It shows the prices of 14 drugs in different countries. For example, the chemotherapy drug Trianda is priced at $57,000 per month in the United States, but only $4,600 per month in South Korea. That's a price difference of $53,000 per month. Insulin for dogs, yes, you heard that right. In Canada, insulin for dogs is priced at $16, but in the United States, the same medication costs $160. That's a price difference of $144. For cats, the antibiotic Clavamox is priced at $35 in Canada, but in the United States, the same medication costs $145. So the price difference is $110. And for us humans, the HIV medication Atripla is priced at $1,400 in Canada, but in the United States, the same medication costs $2,400. That's a price difference of 95%. Another big difference is the antidepressant Prozac. In Canada, Prozac costs $37, but in the United States, it costs $184. That's a price difference of 400%. The blood pressure medication Norvasc is priced at $14 in Canada, but in the United States, it costs $57. That's a price difference of 400%. The anti-inflammatory drug Celebrex is priced at $17 in Canada, but in the United States, it costs $160. That's a price difference of 870%. You get the point. America is a great place to be a drug company, but not so much to be a patient. Another reason why Americans hate their own healthcare system is that many do not have access to dental and vision coverage. According to the CDC, 72% of adults in the United States are without dental insurance. Now, this lack of coverage can lead to untreated dental problems like tooth decay and gum disease, which can have serious consequences for overall health. Similarly, vision coverage is lacking. Approximately 61 million non-elderly Americans don't have vision insurance. This lack of access can result in undiagnosed or poorly managed eye conditions like nearsightedness, farsightedness, and astigmatism. And to add to this problem, there is a shortage of dentists and eye doctors across the United States. This shortage can make it even harder for people to find the dental and vision care they need, which leads to frustration and anger towards the American healthcare system. And finally, we must talk about the healthcare infrastructure in the United States. And let me tell you, it is a mess. We are talking about old hospitals, outdated equipment, and a severe shortage of medical staff. These issues can impact the quality of care that patients receive, leading to medical errors, longer wait times, and an overall negative experience. Many hospitals and clinics struggle to keep up with the latest technology and equipment, which can make it harder to diagnose and treat medical conditions effectively. On top of that, there is a shortage of doctors, nurses, and other healthcare professionals across the country. This shortage can lead to longer wait times for appointments and emergency room visits, as well as a heavier workload for the healthcare professionals who are available, leading to burnout. This infrastructure problem doesn't just affect rural areas, it is a nationwide issue. So, it doesn't matter where you live in the United States, you will probably experience these problems one day. In conclusion, the American healthcare system faces numerous challenges that negatively impact the quality of care and the overall experience for patients. From high administrative costs to unaffordable drugs, lack of access to dental and vision coverage, and an aging healthcare infrastructure, there are many reasons why millions of Americans secretly hate their own healthcare. It's time for change. We must demand better from our healthcare system to ensure that everyone has access to quality care regardless of their background or income. Hopefully, someday things will improve for the American people, but until then, please stay safe and take care of your health. Thanks for watching.